How you doing? My name is Chris Souza, and this is the effectiveness of blood flow restriction therapy. Blood flow restriction training is a new rehabilitation technique involving the use of a cuff/tourniquet system positioned around the proximal end of an extremity to maintain arterial flow while restricting venous return. Blood flow restriction therapy manipulates oxygen flow to the working muscles by occluding the venous return with low load resistance training. It induces muscular development through several proposed mechanisms, including anaerobic metabolism, cellular swelling, and induction of type 2 fast twitch muscle fibers. Blood flow restriction therapy aids in preventing muscle weakness and atrophy amongst musculoskeletal rehabilitation patients, causing delayed to functional activity. So in this case, the medical diagnosis of the patient sustained was a complete Achilles tendon rupture in the right leg. The patient is a men's basketball athlete who is 6'10", 230 pounds. He has a previous medical history of 2 tears in his ACL, anterior cruciate ligament, prior to the season. Before his Achilles tendon surgery, the patient had no functional impairments, limitations, or disabilities. After surgery, the athlete's limitations obviously changed. He cannot weight bear, restore length of the tendon, or provide tension. Also, the tendon was stiff, slight fusion along the surgical scar. Currently not on any medications besides ibuprofen to deal with pain and discomfort from the injury, and the patient had short-term goals to protect the surgical scar, watch out possible infection, minimize that muscle atrophy, which blood flow restriction therapy is looking to do, in their quads, hamstring, glutes, and over elongating the Achilles before beginning to weight bear on crutches and then work with balance proprioception activities. The purpose of this case report is to outline comprehensively outcomes assessments in individual athletes following a surgical managed Achilles tendon rupture with the use of blood flow restriction therapy, capturing different aspects of tendon's health. By understanding the beneficial or non-beneficial uses of blood flow restriction therapy in the rehabilitation process, it can help determine the rate of recovery and the patient's outcomes to ensure that the patient is progressively steadily with rehabilitation. The reason I selected this patient for the case report is due to the significant injury sustained, in which the rehabilitation process can take over a year. This case report purpose is to demonstrate that low load blood flow restriction training, approximately 25-35% 1 rep max, can induce the similar muscular and tendinous adaptations to a high load resistance training, which is 70 to 85% 1 rep max. It is believed through the research that blood flow restriction training allowed the both subject to achieve increased strength and endurance with lesser loads than using traditional rehabilitation methods. The study has shown that demonstrated with low load blood flow restriction training can induce the muscular tendinous adaptations that are with the high resistance training. The results are of high relevance of both sports rehabilitation settings when lifting of high training loads is contraindicated. It is believed that the method can be effective in optimizing function after both primary and revision surgery setting to allow for early rehabilitation for patients. So allowing to become rehabilitate early, but also rehabilitate at a higher capacity in the beginning of rehab than in the middle or towards the end, basically by being able to get the athlete, patient, or whoever is using this method on the field quicker, stronger, and safely. With this research, low intensity blood flow restriction also received significant improvements in functional capacity, strengthening endurance in each clinical presentation. Comparable improvements in muscular strength and hypertrophy were shown in the low intensity blood flow restriction over conventional trainings during inpatient rehabilitation. There was also significant improvements achieved in the functional capacity of muscles that were rehabilitated. The results of the light load blood flow restriction therapy show it has the potential to induce positive adaptations in the absence of high mechanical loads. The induces of muscular development proposes mechanisms including anaerobic metabolism, cellular swelling, and induction of type 2 muscle fibers, as I spoke about earlier. However, the evidence suggests that blood flow restriction therapy in the absence of exercise results in a favorable muscular adaptation. The idea is another realm where researchers can continue to provide more information on this new rehabilitation technique, and additional studies should be conducted to find the optimal occlusive pressure to aid the training improvements. Research and literature Literature from this study has support that blood flow restriction therapy can lead to improvements in muscular strength, endurance, size, and markers of sports performance in healthy or injured athletes, acute or chronic. Combining traditional low-load resistance training with blood flow restriction therapy may allow athletes to maximize athletic performance and remain in good health. Although each patient showed varying degrees of improvement, blood flow restriction therapy within the research articles in my systematic review, along with this patient, were able to safely achieve functional levels than what conventional training has. Blood flow restriction stimulates that muscular strength and hypertrophy gains at much lower loads than the traditional methods, and then allowing the patients to rehabilitate process much sooner. And then most clinical research of blood flow restriction therapy completed in combination with that low load has been consistent throughout research and then observed in results in improvements of muscular size and function. However, additional studies should be required for this new technique because how new it is, and just meaning more years for the study. Unfortunately, during this case study, the athlete, when he was during week 8 and 9 of rehab, re-ruptured his Achilles tendon. It was undetermined if blood flow restriction therapy played a role in this, but it then also did not assist in the case study that prevented that was completed. Thank you for everyone who's listened to this, and have a great day.